So I just want to give you a little bit of a background about. I talked before about us being part of. We have our own ecosystem, we have our own connections, we have our own network and community, but we are part of something bigger. DHI is a member of the European Connected Health Alliance. That joins us to 25 plus other networks around Europe and beyond. So there are over 300 members of the ECHAlliance. They are a non-profit, not-for-profit organisation. Approximately engages about 12,000 different people as part of that conversation, over 30 countries. And we have international events, and they're involved in European projects as well. So again, it's about scale, it's about what we're trying to do in Scotland, but linking us into that broader knowledge network as well. So again, a quote from former VP of the European Commission: "E-health ecosystems could be the answer to the strain our social security systems are undergoing. If we work together and use the enormous potential technology has to offer us, we can ensure top healthcare for all in Europe." So that's a big aspiration. And again, I was in Brussels on Monday. Not my favourite city, I have to say, but it's a necessary place to go if you want to be influencing what's going on in and around Europe. We were in amongst the DG Connect community. I'm not even going to explain what that means, but it's a group of people who have a lot of funding towards digital health and care in Europe. They are really pushing the European Connected Health Alliance to put some bids in for money for a collaboration in the European Connected Health Alliance to do something at scale around digital health. We are right at the heart of that from a Scottish point of view. So again, lots of great things going on. Sometimes can be quite hard it's easy to engage with the European Union, much harder to get any kind of money out of them. This potentially is something that could be slightly different. Again, it's a case of watching this space, but it's an ever-evolving scenario. But we've got an opportunity, and as I say, we were in quite close to the start of this anyway, and quite close to this organisation. So very similar, as I said, approach in terms of what we are doing. It's just about scale and about engaging others in that conversation. So again, it's about doing things geographically, and again, we face the same problems in this country that we're facing in most of this European Western democracies, and even beyond Western democracies. The same health challenges are facing us mainly on a global basis. So we know that if we work well in Scotland and get these collaborations right, get these products right, we know that they've got application elsewhere as well, and that's good from an economic development point of view as well, and that's a big aspect of this as well. The business part of this is just as important in many ways, because again, even if you take it very simply, the more we have in terms of success around economic development, the more people are in work. The more people are in work, the less likely they are to be ill or in hospital or needing services. That's a fact. So that growth takes people out of the areas and areas of health inequality that they may be in otherwise as well. So again, there's lots of stuff going on there. I'm not going to get into all the detail. These are the ecosystems that exist today. So the ones down the left-hand side there, and you can see we're third from bottom. That's not in terms. That's just alphabetic rather than anything else. We were one of the early ones, influencing this whole agenda. These ones are launching soon. Canada goes obviously beyond Europe, as does the New York one, and the China one. I can't even remember where that is. It's not even on there. But the China one is a really interesting one as well. Again, particularly from a commercial development point of view, an enormous market potential. Expensive to enter for a lot of businesses, but again, maybe through this route, maybe through other connections through the UK relationship with China and the Scottish relationship with China, from a government point of view, there are emerging opportunities for businesses to penetrate that market with the right kind of products. The Alliance, recognising that it's spread across Europe, very difficult to get people together on a regular basis, and you wouldn't do it because it's very expensive, and it takes a lot of time to do that. So very much more like most organisations are starting to rely and use technology more to help do that. So the European Connected Health Alliance are building a platform, a connector platform that will allow all of this kind of collaborative working and showcasing, and the ability to have conversations. It's a business Facebook type approach that allows like-minded people to have good conversations. If you're interested in what that looks like, you will have registered for this event through the DHI website. That website if it was true to its full potential, would be able to do this. It's all the same functionality. This is actually built on the same platform that the DHI one is built on as well. So that's just, again, just a mechanism. We got together on Monday, and that was the second time all the coordinators of ecosystems had got together, once in February and then once earlier this week. At the February one, we came up with areas that we were all commonly working in and commonly interested in across the majority of these ecosystems. And these two areas came out around medicines optimization and around e-health strategy. And we are keen to support both of those. We've already got a strong interest from the e-health, the Scottish Government e-health team, in terms of supporting the e-health strategy work that Ian and Estonia was happy to lead. He is the senior guy, the senior e-health lead in Estonia, which is population-wise quite a small country, but they have got a complete electronic citizen platform now across the whole country, which is really inspiring. It shows what's achievable, and it's a very much a kind of digital-first economy now from accessing public services, including health. So they have lots of good practice, things that we can learn from, in terms of that much smaller population, but again, things that possibly and probably scale up to our needs as well. The other one around medicines optimization, this medicines adherence, medicine compliance came up this morning. I don't know whether it came up in the workshops this afternoon, and the challenges that dementia, people with dementia face with that, and carers face with that. So there are many emerging technologies that can support that, but there are many flaws with that technology as well. Many ways to cheat it, if you're that way inclined. So there is a group emerging now to look at that, because it's a common problem, not just for Scotland, but a common problem across all of these ecosystems. So I actually got a name suggested to me this morning, which I'm going to follow up on in terms of a Scottish representative on that group as well. So rest assured, we will be at the heart of this stuff as well. And if there's learnings come from that, that again feeds back into all the work we're doing. And the work that's happening in the broader UK as well, and we'll share that back out. Digital Health and Wellness Summit. This is This is like an annual get together. It's part of Mobile World Congress in Barcelona, biggest conference I've ever been to in my life. 93,000 people went to that last year. This is what, 50 people in the morning, 50 people in the afternoon. Okay, so if you take the whole footprint of the SECC and multiply it 10 times, that's the size of the Gran Fira in Barcelona. It's a small city, for a week. It's unbelievable. Now, as part of that, the European Connected Health Alliance have a digital health and wellness summit, which attracts probably about 1,000 people. But it's a fantastic event. It was great last year, and you can see some of that's the program, the high-level program for the 4 days that it's going to run. The main day, or the main 2 days really, are about these 2 days here in terms of conferences and workshops. About, again, I suppose, what we can do, and again, a lot of good international, and it's not just about Europe. There are good US-based speakers there. A lot of leadership going on around digital health in places like California, and we get quite a good international representation around that. Again, one of the things we're going to do, we're going to run a bit of a competition, because that's what we do in DHI. We run lots of different competitions and challenges, and we're involved in a few ourselves. So one of the things we're going to do, and it could be a dementia innovation, it could be, we operate in lots of different areas across the spectrum of health and care. We've got emerging things around diabetes and long-term care and outpatients and other things that I've mentioned already. So we are going to have a competition between now and February, and the ones that are evaluated as successful, and we've still to define criteria and what exactly the challenge is going to be. The reward there will be the opportunity to go to Barcelona and face a dragon's den of investors with the potential of getting your work funded. So again, it's a good way to stimulate innovation. It's a good way to stimulate good quality as well. So again, just watch this space for some of that. So again, that's just some contact details there. We'll share all the slides with everybody. So that's us at the last bit now. Next steps. So what? What have we done? What has today been about? This was probably the second part of the process, if you like, that we've seen as a bit of a recipe for success in the past. the first part happened all before this, all the preparatory work and all the kind of conversations about how, what's the best way to sort of, lead people into the conversations in terms of identifying the sort of key speakers, what should be the subjects of the workshops. Quite a lot of work went into all of that. Today was the second stage in terms of having that conversation and getting those ideas. We will synergize all of that stuff. We will publish that out, hopefully in relatively short order, to inform a call for innovation. And we'll look for proposals and applications and proposals to come from individuals, or collaboration, or organisations, or collaborations of individuals and organisations in response to that. We will evaluate those as DHI. We will the ones that fit our criteria. We will take through an evaluation process and an approval process, and successful ones we will fund, and we'll fund the academic evaluation of that project. For ones that don't fit our criteria, we will signpost potentially elsewhere, but they will form the part of that increasing knowledge base that we have. So none of it will be lost. Everything we've done today will be fed into that consultation process that David referred to as well. So again, none of this is wasted. And again, I want to thank you for your time. So we're aiming to get that out within the next 4 weeks, because we have another ecosystem coming up in December. Last one before the end of the year. We have about 3 or 4 of these a year. And this one will focus around, and again, as David had mentioned, health and social care integration. Big agenda item from a Scottish Government point of view. One of the things that actually makes a difference in terms of shifting that balance of care from the primary and acute, particularly acute care environment, into the community. And again, we see technology as a big lever to allow a lot of that to happen. So that will be at Strathclyde University's new Technology and Innovation Centre on George Street, I think it is, on the 10th of December. So if anyone's interested, just keep an eye out on our website, it'll be there. Or if you think you know anybody that might be interested in participating in that, please share our details with them. We have a post-event evaluation survey. I'll just encourage you to complete that. If you've enjoyed it, tell us. That's good for my staff's appraisals, and they need some of that, because I push them quite hard. If it wasn't so good, tell us as well, because we want to improve the next ones. Again, if it's anything to do with format, the venue, anything at all, please let us know, and we'll do our best to try and improve it the next time. Other than that, thank you very much. It's nothing without the people coming along, and particularly the workshop piece, the information, the knowledge we get is the most valuable asset that we take away from this. And hopefully you're inspired to go away and innovate and respond to this call as it emerges within the next few weeks. So thank you very much.